Welcome back to Healthy Living Live, coming to you from the Norton Brownsboro Hospital. And I think it's safe to say that just about everyone has suffered from the condition we're going to discuss now. Jackie, is that safe, you think?
Absolutely. Headaches. I think we've all had headaches of one kind or another, some that are often, some that are not so often. And with us now, another neurologist, Dr. Brian Plato. And we are talking, what percentage of people have headaches? It's probably got to be 98% or something.
Exactly. Nearly everyone has experienced a headache at some point in their life, but about 12% of individuals have the most common headache we see in the office, which is migraine. About 18% of women and 6% of men have ongoing troubles with migraine.
Wow. And there are also cluster headaches. What's the difference in migraines and cluster headaches, or is there a difference?
Absolutely, there's a difference. There's a difference from the biology of it, but also in what the patients present with. It's a very detailed explanation. We'll save it for another time, but in short, migraine is the most common headache that individuals are going to be experiencing.
Do you call headaches, I notice we say what causes them, but you call them triggers. Now, my wife would say I'm a trigger. Okay. What is a trigger for a headache? Are there some that are very common?
Exactly. The idea is that everyone is able to be susceptible to a migraine or a headache if the number of triggers, and what I mean by that is, if you put together bad weather, a stressful day, certain foods, for example, that can all trigger a headache. So we call those individually triggers. And so it's looking to see with certain patients, can we identify what those triggers are, so perhaps we can avoid some of them. But some triggers are unavoidable.
How do you figure out what's going on, and then how do you figure out treatment?
So I think the most important thing is actually sitting down and having a discussion with the patient about what is it that they're experiencing, because the patient can tell you best what they're experiencing. There's no blood test that says this individual has migraine. It's really just based on what we see in talking with them. And so it really is a conversation with the patient, and then sometimes, if necessary, further testing we need to do. And then once we've come to that diagnosis, the treatments are largely dependent on what that diagnosis is. So if the patient has frequent migraine, we're looking at treatments to prevent the migraine attacks. If the patient maybe has episodic or infrequent migraine, maybe they just need a treatment for when they get that headache. And there are specific treatments for individual types of headaches.
I know that you work a lot with the Norton Headache and Concussion Center, so there is a unique place that deals with these kinds of problems.
Exactly. I'm very fortunate to be in the position where we are, where we have the dedicated resources and the staff, the physicians, the additional staff to help us get these patients the help that they need, because previously patients were having to travel to great lengths to see physicians that were specialized in the treatment of headache, and then concussion is part of that, because as you well know, one of the most common symptoms individuals have after a concussion is ongoing headache.
So we talked about how common headaches are. Where is the threshold? Where is the point when someone should say, look, I need to see a neurologist?
That's a great question. I think that individuals should seek medical help when they come to a point where they realize that this is interfering with the quality of their life, whether that's missed work, missed school, missed things with their children, their family, their loved ones, or if there's a concern that they have. Patients oftentimes come to me very, very anxious that maybe there's something else going on, and only we can walk through with the patient and say, no, there isn't something else, needing to see Dr. Sun or something like that, with tumor or something of that nature.
Yeah, because sometimes I've had friends say, gee, I've had these headaches, I must have a brain tumor. Well, it could be just something as simple as something in their diet. Like, I know some people can't taste products with aspartame or with these super sweeteners.
Right. Many of these products that are in our artificial foods and our preserved foods really are, again, triggers for headache for individuals. And I think it's important to mention, associated with Dr. Sun's work, is it is very uncommon for individuals with headache to actually end up going on and having something such as a brain tumor or another very serious condition. Usually there is not something we identify. So go to reassure your listeners that there probably is not something else going on.
That's good.
You mentioned in the opening of the conversation that the effect that you were talking about migraines, and I think you said 18% of women, like 6% of men. I think that was the statistic. Why are women more prone to have migraines?
There's a variety of reasons. Probably the most obvious reason is the differences in hormones between men and women. Estrogen being a big one. There are 2 times during each woman's monthly cycle where estrogen levels drop, and that oftentimes can trigger a migraine for the individual. individual. So probably that, some of the differences with stress and all those other factors that women have to face that men oftentimes do not.
Is there a genetic link to headaches? Because I know that my mother-in-law has migraines, and my sister-in-law, her daughter, they have headaches. Is there a tendency, if your family member has them, that you might too?
Absolutely, there are. There is a definite genetic link between parents that have migraine and their children going on and having migraine. There are even specific genes we've been able to start to identify that we know that these individuals have these genetic predispositions for migraine.
All right, I'm going to ask one more question here. What do you recommend over the counter for those who have headaches? Your recommendation.
So my favorite thing over the counter for preventative purposes is magnesium. I recommend 400 to 500 milligrams a day. I also like coenzyme Q10
right.
And riboflavin, which is vitamin B2 from a preventative standpoint. Now, over the counter, when you're talking about the acute treatment of headache, and that means to me when you're treating an individual headache, I really want to caution listeners because you can really quickly get yourself into a state of what we refer to as medication overuse headache, or rebound headache would be another name for that. And that is when individuals are taking over-the-counter medicines such as ibuprofen, Tylenol, Excedrin, etc., more than about 2 times per week can actually make their headaches more frequent, more severe, and less easy for us to treat.
Great information.
Mm-hmm.
So for folks out there who have headaches, we've hopefully given you some options, but if you want to find out more about the Norton Headache and Concussion Center, you can again call 629-1234 and get that information.
Thank you very much.
Thank you very much, Dr. Plato.